In the stillness of the ICU lab, where every drip echoed purpose, we look our first step into the heart of healing.
At Rahman Institute of Nursing and Paramedical Sciences, we believe in preparing nurses who can take charge in the most critical situations right from the first day of their career.
In our lab, we learn everything, from checking vitals, adjusting oxygen, to setting drip rates accurately. Every step matters.
I can now read an ECG, calculate the heart rate, and know its urgency. These skills give me confidence, especially in Rahman Hospital Rail ICU.
We are trained to reposition patients, adjust bed height, and ensure constant movement because even comfort is a form of care.
Input-output charting, checking drug doses, stocking the right emergency medicines. These are the daily duties that we practice till they become instinct.
Glasgow Coma Scale Assessment helped us to measure a patient's consciousness level. We also learned full body care from eye cleaning to back care, just like ICU nurses do.
Here we have worked with real ICU equipments like tracheostomy tube and incubation tray. We don't just see, we do it ourselves.
It is one nurse, one patient, that is one-to-one training. In the Rahman Hospital, here I have got an opportunity to work in real ICU with the real patients, and here I have learned so many things from our senior staff nurses.
With hands-on ICU training, guided by skilled mentors and powered by Rahman Group of Hospital, our students are not just ready, they are reliable.